So physical wellness, how do we keep animals healthy? We do it by having strong wellness programs, and I'll talk a little bit about these and then refer you to some other resources, because these guidelines have already been developed and you don't need to develop new ones for the most part. Strong cleaning and disinfection protocols and prevention of overcrowding and stress. So let's start with shelter wellness programs. We know that there are two ways to get animals healthy. One is to prevent disease in the first place, and another is to provide treatment. And it's almost always the case that prevention is more cost-effective and more efficient in maintaining health than waiting for animals to get sick and then trying to treat them. And we all know this if you think about the cats with upper respiratory infection. Once they get sick, it's a couple weeks out of their life and your life and that cage space, and before they're ready to be evaluated for adoption again. So if we can keep them from getting respiratory infections in the first place, we can turn over that space and save more lives. And all of our speakers today have touched on the fact that when we create bottlenecks that stop flow or stop intake or lead to crowding in our shelters, that costs an animal life somewhere. It may not be in your facility, but there's an animal out there waiting to come to your facility that didn't get in, or some other way an animal might lose its life. So our obligation is to be as efficient as possible. A diseased animal in the shelter, if it's not recognized, certainly has the potential to cause spread of disease, and there are some diseases that we can be very good at screening out, like ringworm, before they come in, and then others that are more stealthy. And in Florida, for example, we have a huge problem with outbreaks of distemper, because animals frequently look very healthy when they come in shedding distemper, and there isn't any good point of care tests that we can screen dogs with when they come in. And ultimately, these disease outbreaks may lead to euthanasia because of illness or death in the shelter, and that reduces our life-saving capacity. So the wellness care really starts at the moment of intake, and you wouldn't want to put your veterinarian up in the intake area because that's not a good use of their time. Your trained staff can perform very good intake procedures. So what they need to be trained to do is a quick health assessment. This is not the veterinary physical exam, but they can perform a fairly robust and fairly quick health assessment to determine if an animal can go straight into holding or needs to be diverted into veterinary services for further assessment. We've heard before that we do recommend that all animals be vaccinated immediately on entry. We used to think that it took a few weeks for vaccines to work and offer protection, and it is true that they're not fully protective for a while, but we also know that response to vaccination starts within hours of immunization. So if we can vaccinate an animal at the time of intake, it really becomes a race between exposure to disease in the shelter and that vaccine starting to work. And we do recommend, and it's very clear from lots of research, that we should be using live virus vaccines. Ideally, if you have the option, it's even better to have people bring the animals by before relinquishment, vaccinate them, and send them home for 2 weeks, and then bring them back for relinquishment. And in some shelters that do admission by appointment, that works very well. Some sort of internal and external parasite control needs to be administered at admission. The minimum would be at least some pyrantel pamoate for roundworms and hookworms, and some flea treatment if you're in an area of the country like we are that have lots of fleas. And we know that the healthy animals then can go straight into foster, which is great, or to holding, or straight through adoptions if they're ready to go, and that the diseased animals can be diverted to the vet care team for further assessment. Wellness also is going to incorporate behavioral wellness, and this has been overlooked in sheltering until very, very recently, and it is equally important. Just because the signs of behavioral illness or stress are more subtle in many cases than coughing or sneezing or diarrhea does not mean that we should shortcut on assuring that our animals have good quality of life. And we've heard today, and it's completely true, that stress is a silent killer in shelters. It wipes out the immune system, and no amount of vaccination or medication or antibiotics can overcome that. So what we see here are two different approaches to cat housing. We have the traditional steel cat units where there's very little space. Cats can't really express any of their normal behaviors. They can't even walk a few steps or stretch out full length or raise their tail to its full length. And with even modest modifications, you can create housing like this, and you can see those two kittens look so much happier. And what they've done, you can see they've drilled holes through these traditional stainless steel cages from one to the other to make little duplexes, and hung up some hammocks that the volunteers make. And now you can have a much more relaxed cat that has its food separated from its toilet, and some other enrichment that will make its stay in the shelter happier. And then it's also very important that we don't lose track of animals that linger in the shelter. We consider short-term housing to be 2 weeks or less. And anything longer than that, we would call long-term housing, and those animals need a special plan because their behavioral needs increase the longer they stay in the shelter.